Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. Today is November 4th, 2025. This video is on a JAMA article titled Development and Validation of the Sequential Organ Failure Assessment Score, or the SOFA-2 score, published online JAMA, October 29, 2025. There's an accompanying editorial titled A Revision to Organ Failure Assessment in Critically Ill Patients. Sequential Organ Failure Assessment score updated after 30 years to SOFA-2 to reflect modern ICU therapies and monitoring. Methods: federated analysis of 3.34 million ICU encounters from 1,319 ICUs from 9 countries from 2014 to 2023. The derivation cohort, 2.1 million encounters. External validation, 1.24 million encounters. Adult ICU patients were enrolled. They excluded organ donors and readmissions. They used generalized additive models, classification and regression trees, and meta-analysis. What did they find? For the SOFA-2 score, area under the receiver operating curve for ICU mortality was 0.79 versus SOFA-1, which was 0.77, so p-value less than 0.001. Each 1 point SOFA-2 rise increased mortality odds by 1.38. ICU mortality was around 8.1%. Key takeaways: SOFA-2 improves discrimination, reflects contemporary interventions, including high-flow nasal cannula, renal replacement therapy, vasopressor dosing. Good global performance, no GI or immune component due to insufficient predictive and content validity. Editorial summary. SOFA, originally developed in 1994, modern ICU practice and organ support necessitated update. Methods: modified Delphi with systematic review. Validated in 3.3 million ICU patients across 9 countries. Key points: incorporates high-flow nasal cannula, non-invasive positive pressure ventilation, vasopressin. Whereas GI and immune were excluded, it resulted in reclassification of 50% of the patients. Area under the curve was 0.79. Limitations and future: chronic versus acute dysfunction not addressed, missing data challenges, relies on therapy. The future is integration with electronic health record. Key takeaway: though modernization improves validity, maintains simplicity, it invites further biologic refinement. Clinical pearls: SOFA-2 better aligns with modern ICU, use of vasopressors, ventilation modes, and renal replacement. Area under the receiver operating curve improved modestly but consistently, retains simplicity and bedside feasibility. Longitudinal scoring, days 1 to 7, predicts outcomes strongly. SOFA is derived from the Sepsis 3 framework. Singer and Vincent were among the key pioneers. Contemporary update led to International Critical Care Consortium. If you enjoyed this episode, share it with your colleagues. When we change how we see disease, we change how we shape lives. Until next time, stay curious, stay compassionate, and keep seeking wisdom. Podcast brought to you by masterbedfacts.com. This podcast is for physicians and healthcare providers. If you enjoyed this video, please like, subscribe, and forward to your friends.